Hi, my name is Yang Lee, and today we are outside CLS Health Comprehensive Care Clinic in Webster, Texas. Today we're talking about measles. I am with Dr. Issa, the director of the largest private infectious disease group in Houston. Dr. Issa, can you please tell us about the measles outbreak?
At this point, there is in Texas 142 cases. Around 100 are in Houston, and it seems like 20 are hospitalized, and unfortunately, there was one child that died.
Can you tell the audience what they should look for when it comes to measles outbreak?
It's inhaled, so it causes a runny nose, red eyes, a rash, fever. The rash generally involves the whole body, sometimes could be in the mouth, and then can travel from the respiratory system to the whole body, could cause diarrhea, could get to the brain, cause encephalitis.
What is one way that a person could prevent getting measles?
The key things in prevention is vaccine. Unfortunately, there's no treatment, there's no other ways except vaccination. Of course, you can stay away from sick people, especially if you're not vaccinated, especially children, because they're the highest risk of mortality and death. It's a very infectious virus. Like we all learned about R0, which is the infectivity of the virus. For COVID, every one infected person can infect 5 people. For the flu, every one infected flu person can infect 1.5 people. But for measles, it is 1 to 18. So one infected person can infect 18 to 20 people. So it's highly contagious. And what makes it very contagious, it's airborne. If somebody just breathing or coughing and he passed by this hallway and you come in up to 2 hours later, you could inhale that virus. And if you're not vaccinated, very likely you're going to get infected. Prevention is the key.
There's a lot of misinformation about the MMR vaccination.
The biggest myth that it does cause autism. That is not true. Live attenuated virus means that it's a weakened virus. People might get a reaction to it, a little pain at its site, maybe a little fever. But these are the most common side effects and usually resolve on its own. Serious side effects are very rare. I vaccinate my kids, very safe, and it's mandatory for us as healthcare workers taking care of people because it's highly contagious.
If you could have one message to give out about the measles outbreak and all the citizens of Texas, what would the message be?
Prevention. Prevention is key. There's no treatment, so you got to vaccinate.